As future trainers of community healthcare workers, you need to know the roles of the community health workers and the tasks attached to these roles to be able to develop a plan of training for them so they can acquire the necessary knowledge and skills and develop the right attitude in the performance of these tasks. Good day, everyone. Our learning objectives for this session is to be able to formulate or design a course program given the roles and tasks of a community health worker, and develop a lesson plan for a particular topic of a course program. As an overview, you started with identifying 8 priority problems in CTUERM using the nominal group technique. You were then tasked to formulate a program plan, which is community-based, to address a priority problem. Then you went into listing the roles of a community healthcare worker in a primary healthcare setting and identifying the tasks and subtasks related to these roles. These tasks were analyzed in terms of the knowledge, attitude, and skills needed in the performance of the subtasks. This now forms the basis for designing the course program and lesson plan. The tasks will be grouped to form the content, formulate the learning objectives, devise learning strategies, and evaluate learning or training outcomes from the course. The course program is a written plan for each course or course module or a general training outline that takes into consideration the proper sequencing of the topics, specification of objectives, time frame, whether it's in months, weeks, or days, teaching strategies, training materials, and evaluation methods to facilitate learning. These are the parts of the course program lifted from the manual. Since the main purpose of the course is to train community health workers to do a job, it is based on the task analysis. You start by making a list of all the tasks that the health worker is expected to do. Then each task is analyzed to find out what skills are involved and what knowledge and attitudes are needed in order to do it competently. From the list of the tasks and subtasks of the community health worker, the topic and its contents that need to be learned are identified. The must learn is the target. This refers to the body of knowledge, skills, and attitude that the community health worker needs to learn to be competent in their work. The contents are organized into logical units or sessions. Then they are arranged in sequence and linked with appropriate units to provide continuity. Ample time is allowed for each session or unit and the entire module. As shown in this example on a module on caring for pregnant women, the role of the community healthcare worker is specified as a healthcare provider for pregnant women with its corresponding task of being able to identify a high-risk pregnancy. The subtasks are itemized as follows: obtaining relevant history, performing a physical examination, identifying risk factors for a complicated pregnancy, assessing the patient's risk, and explaining the findings to the patient. These tasks are grouped together to form the content for the topic. The first 3 tasks deal with getting the history and physical examination, and the next 3 pertain to risk assessment. The next step is developing teaching or learning objectives for the session or unit. The learning objective is a statement that describes what the learner or trainee needs to know, attitude or skill that needs to be developed at the end of the course to perform the subtask. It does not describe what the facilitator will teach or the experiences the learner will have during the course. The learning objectives for the course are also derived from the list of tasks. The learning objective should be written in measurable terms, that is, use an action verb in describing an observable behavior of the learner. It should specify the condition or circumstance under which the behavior or performance must be manifested or demonstrated, and it should specify the minimum acceptable level of performance or degree of accomplishment. For example, at the end of the session, the participants should be able to discuss the different degrees of malnutrition. Discuss is the action verb. at the end of the session is the condition, and different degrees of malnutrition is the minimum level of performance. So the learning objectives for the course corresponds to the list of subtasks identified in the previous exercise. The next step is to select an appropriate method to enhance retention and foster cooperative learning. Teaching strategies can take the form of case studies, which are paper and pencil exercises and are very valuable in teaching decision-making skills. The essential feature is that a situation is described in words or possibly pictures. Then the learners are asked what they would do. The situation may relate to the diagnosis or treatment of patients or to any of a wide range of managerial or organizational problems. In projects, they are made to find out about a particular health problem. And when learners do project work, they find out facts and by doing so, also increase their skills in talking to people and collecting and reporting information. Small group discussions encourage sharing of experiences within the group. Role-playing is for practicing communication skills, like for example, persuading a mother to have her child vaccinated, then invite discussions from the group as a whole about the way the learner or health worker behaved. The aim of simulators is to give the learners some experience and practice in using skills before they work with actual patients or expensive equipment. You can also use demo return demo, provide models, examples or experiences, use of evocative discussions or sharing of experiences, as well as the inclusion of games. In the example, discussions were used for learning objectives 1 and 3, demo return demo for numbers 2 and 4, and role playing for objective number 5. The next step is listing down the learning resources or teaching materials or aids. This could range from visual aids to equipment needed for the training. As an example, the following teaching materials may be used for a given teaching strategy involving a particular learning objective. Then decide on the appropriate assessment method for the teaching learning session. Assessment is said to be valid if it tests important skills and abilities directly achieved through the learning objectives. It is important to make sure that the students or the learners will be able to do the job competently, to encourage the learners to work harder, to guide facilitators and trainees about which parts of the course have been successful and which parts need to be improved. That is to identify strengths, weaknesses, or misconceptions. These are the available assessment methods. In oral examination, the examiner can ask for more detailed information and can probe to find out how much each learner knows. Short answer questions often ask learners to give examples, write down some advantages, or draw a diagram. They're more specific than essays and they're quicker to mark. Multiple choice questions check factual knowledge and are also very helpful when used for self-assessment or peer assessment. Your patient management problems are a series of questions which are asked about a case. It can be used to test learners on a wide range of subjects. It can also be used wherever learners are being trained to make decisions. Casebooks contain a list of skills or tasks that the learners should be able to do. The learners are responsible for learning how to do each of the tasks, and when they are ready, they can ask the facilitator to assess their performance. During the course, the student must perform all of the tasks to a satisfactory standard. In checklists, the trainer can watch the trainee perform a task and puts a tick on the right-hand column for each part done correctly. At the end of the test, the trainer adds up the number of ticks in the right-hand column and gives the trainee a score out of a total. This is also used for assessing a psychomotor skill. In this example, the following assessment methods may be used to assess whether the learning objectives have been achieved, like short answer questions on getting the medical and obstetric history, or identification of risk factors of a complicated pregnancy, completed items in a checklist for conducting a thorough physical examination or providing correct counseling, or case problems for risk assessment. This is a sample of a teaching learning module on caring for pregnant women for the topic high-risk pregnancy. It is therefore expected that an entire course program should contain more than one module and more than one topic, which will span for more than a day. It will likewise need to consider the other roles of a community health worker, not just as a healthcare provider, and the tasks and subtasks related to the role. To summarize, these are the steps in formulating a course program. These are the general instructions for the development of the course program. Based on the list of tasks and subtasks and analysis you did in Workshop 6, you identify the topics that will be covered for the training, arrange them in sequence, and allot proper time for the sessions related to the topics. Formulate your learning objectives, choose the strategies or methods for teaching, and identify the equipments that will be used. Please take note that the course program should take days and not just an hour. Do not cram several topics in one session. Allot only one topic per session, and make sure that the topics are in proper sequence. A lesson plan serves as the guide in delivering to the trainees what they need to learn as primary healthcare workers in a teaching learning session. This is the format of a lesson plan as seen in your manual. The steps include first defining your general and specific objectives. Then, in the introduction, if the selected topic is in the middle of the course, provide continuity or bridging statements with previous sessions or lessons. If the topic chosen is the first topic in the course, then the introduction should include a briefer of the course and a course outline. The main lesson should include the actual script that the facilitator will follow, complete with the details of the learning resources and assessment tools to be used. The conclusion should likewise include a script on how you will end the session. These are the general instructions on the creation of a lesson plan, which also appears in your manual. So first, choose one topic in your course program that you will develop into a lesson plan. The plan should be innovative. The strategy should be interactive. The actual lesson plan should be as detailed as possible, complete, and preferably in local dialect. If the topic chosen is in the middle of the course, introduce the topic in relation to the previous session, or if it is the first topic in the course, the introduction should include a briefer of the course. A script of the main lesson should be included. If games will be used, the mechanics and materials needed should likewise be included. The conclusion should be in script and provide a copy of the actual assessment form, whether this is a pre-test, post-test evaluation, or an observation checklist. This is an example of a lesson plan in the production of an improvised mosquito trap. The topic appears to be in the middle of the course and is introduced in relation to the previous session. The main lesson details the step-by-step process in the making of the improvised mosquito trap. The facilitators ended the session by reminding everyone on the importance of prevention. Pre-test or post-test and return demo were the tools used for assessment. In summary, you need to formulate a course program based on the list of tasks and subtasks. Choose one topic from the course program to create the lesson plan and implement the lesson plan through a health teaching demo 2 to 3 weeks from now. These are the references used for the lecture. Good luck on your presentation and thank you for listening.